Good morning, everyone. Today, we will be discussing Chapter 12, which is Healthcare Epidemiology and Infection Prevention and Control, up until Chapter 13, which is Diagnosing Infectious Diseases. We are Group 3 from DSN2C, and I am Francheska Serrano, along with my group mates.
I am Genrix Baclig.
I am Julianna Barrera.
I am Beneth Jesus.
And I am Rayna at Puno.
Rated infections or HAIs, infection prevention and control, which has multiple subtopics, which we will be discussing for this morning. Starting off, what is healthcare epidemiology? Healthcare epidemiology can be defined as the study of occurrence, determinants, and distribution of health and disease within healthcare settings. We should know that epidemiology or healthcare epidemiology is the relationship or interactions between pathogens, the patient, and the environment, which is within a healthcare setting. Although the primary focus of healthcare epidemiology is infection control and HAIs, it also tackles about the policies, safety measures, not only to protect the patient, but also those who work within an institution. So what is healthcare-associated infections? HAIs, from the word itself, these are infections that we acquire inside a healthcare facility. And harboring or getting an infection can be categorized into categories. First one is HAIs, and the second one is community-acquired infections. So community-acquired infections are those infections that we acquire outside, for example, outside a hospital or outside a clinic, such as our house, our school, and the likes. And always keep in mind that HAIs should not be confused or changed with iatrogenic infection, as iatrogenic infections are those that are physician-induced. For example, in a surgical incision, there was an infection, and it is called iatrogenic because the physician was the one who introduced the infection or the one who caused the injection, not some other kind of um, vector or port of entry. So never interchange them, but iatrogenic infection is a type of HAIs, but not all HAIs are iatrogenic infections. So the frequency of healthcare-associated infections. Based from my research, World Health Organization launched its first ever global report on infection prevention and control, and it revealed that IPC programs or infection prevention and control can greatly reduce infections by 70%. And according to this report, 7 out of every 100 patients in high income countries and 15 out of 100 in low and middle income, we are included in that, which is the Philippines, acquire HAIs with high mortality rates, especially in ICU units. We have observed this during the COVID-19 pandemic because during those, mas naging restrict yung hospitals, kung sino lang pwedeng, during the early days, bawal mag-visit, and kailangan mag-mask, kailangan naka-PPE, bawal palabas-pasok ng hospital, and kailangan maghugas ng kamay palagi, social distancing, isolation, and the likes. And throughout their report, they said that effective IPC, like hand hygiene, was one of the simple way to reduce the spread of microorganisms, could prevent infections by 70%. However, na-reveal din during their report that there is still a gap between IPCs worldwide. That's why they are pushing for this, especially for those in low and middle income countries, to implement comprehensive or more effective IPC programs. Next is these are the pathogens most often involved in healthcare associated infections. And these are hospital pathogens that are drug resistant strains, 70%. This is because continuously we all know that microorganism has its own mechanism to survive. And sa paulit-ulit na pag-introduce ng antibiotics sa mga pathogens na to, they can already adapt to the antibiotics and nare-resist nila para hindi sila ma-eliminate or ma-eradicate. The example of this are Clostridium difficile, aureus, Klebsiella pneumoniae, Klebsiella oxytoca, and Escherichia coli. All of these pathogens have its counterpart diseases such as infection in the colon, diarrhea, skin infections like abscesses, cellulitis, and others like pneumonia, bloodstream infections, and wound infections. They can also introduce meningitis, and one of the most common is UTIs, especially if na-access ng pathogen ang bladder ng isang person. Although we are focusing on those pathogens, infectious diseases can still be harbored not only through those, they can still be harbored on the patient itself, or what we call their own indigenous microbiota. And magiging problem lang ito if makakapasok siya or meron siyang port of entry like a surgical incision or other parts of the body na pwede nilang pasukan. And then next is bacterial spore from a room that is not properly. Other examples of HAIs that are difficult to treat. They are difficult to treat because these type of pathogens are a protective layer, which makes it harder for antibiotics to penetrate and kill them. First is Pseudomonas infections. They are highly adaptable to bacterium, which is found in the soil and water. Next is multi-drug resistant Acinetobacter. They can survive on surfaces for a long period of time. And our topic is HAI, so for a long time, kaya niyang nandun lang siya. And it can spread through different, if matatouch ng patient or matatouch ng healthcare worker, which can spread easily. Acinetobacter can also pick up the resistance gene of other pathogens. So, if yung isang pathogen is resistant, kayang kunin ng Acinetobacter doon, yung gene na yun. Next is carbapenem-resistant Enterobacteriaceae. These are CREs, and example nito is Klebsiella pneumoniae and E. coli. They are resistant to carbapenems, and carbapenems are considered one of the last resort of antibiotics for treating severe infections. CRE can also transfer their resistant genes to other bacteria, which is alarming, kaya it is difficult to treat. Next is vancomycin-resistant enterococci, or VRE. They live in the intestines, but they do not pose a health threat, not unless they enter the bloodstream or the urinary tract of a person. VRE are pathogens that are resistant to vancomycin, and vancomycin is a very powerful antibiotic which is usually used when other types of treatment is not effective. Next is methicillin-resistant Staphylococcus aureus, or MRSA. These genes, yung pathogen na to is kaya niyang i-change yung binding site kung saan usually inaatake ng methicillin. That's why hindi na effective yung methicillin sa kanya. And then lastly is methicillin-resistant Staphylococcus epidermidis strains. Ang Staphylococcus epidermidis are usually found in the skin, and like the enterococci, they do not pose a health threat or problems unless it enters the body, especially in people with medical devices, such as catheters. So as nursing students, we should be very careful when a patient is in a catheter kasi it is considered as a superhighway for kung saan pwedeng pumasok ang infection or saan magpo-form ng biofilm ang isang pathogen. And hindi na nito mapepenetrate, which is hard to treat. So, bacteria are not the only pathogen that have drug resistant. And recently, fungi such as Candida is becoming more resistant to common antifungal agents. So, during 2001, CDC or Centers for Disease Control and Prevention campaigned a 12-step to prevent antimicrobial resistance among hospitalized adults. The first one is prevent infection and vaccinate and get the catheters out. For vaccinate, during those times, 2001, it is very, up until now naman, kailangan mag-vaccinate, especially for those diseases na madaling contagious or madaling makahawa sa iba. So, kailangan mag-vaccinate such as influenza shot or strep for pneumonia, especially to those at risk, like mga older people. Next is get the catheters out. So, as we have tackled earlier, kailangan maging careful sa catheters because catheters is kung saan mag-form yung biofilm which will introduce infection to the patient. And only use catheters when essential. Use proper insertion and remove when they are no longer needed. Next is diagnose and treat infection effectively. Step dito is step 3 and step 4. Target the pathogen and then access the expert. First is, di ba, if may nararamdamang sakit yung patient, they consult a physician. After that, upon consulting, magbibigay ng order yung physician to get a specific specimen depending on the situation. And that specimen should be collected from the patient. Target only the pathogen or culture the patient. After mo makuha yung specific specimen, which could be the possible, where you can test if my abnormalities or my disease, kailangan mong mag-consult sa expert in order to have a accurate diagnosis or result because they are the ones who, if physicians, not us, physicians are the ones who medically diagnose a disease. Next is use antimicrobials wisely. Step 5, practice antimicrobial control or engage in local antimicrobial control effects. So I don't know if from the previous discussions may sinabi na na in every antibiotic na prescribe, kailangang i-document. I-document siya for what disease, for what age, for what lahat. Kailangan siya i-document within that local area para malaman yung trend ng paggamit ng antibiotic. Next is for use local data, parang same lang din ng first. Know your facility's antibiotic program and know your patient population. Next is step 7 and step 8. There's a difference between step 7 and step 8. Treat infection, not contamination. Treat infection, not colonization. For the first one, treat infection, not contamination. This means that, example na lang, situation na. If a patient goes in a clinic to get blood specimen, kasi may nararamdaman siya, you target the infection, not the contamination. The contamination is the one na-introduce sa specimen because of the healthcare workers' fault. Like, kasi example, kunyari, hindi siya nag-observe ng proper hand hygiene, hindi siya hindi tama kung saan niya kinuha yung specimen, and hindi tama yung lalagyanan. So, nag-introduce na siya ng another microorganism sa specimen, which dapat iwasan kasi and dapat hindi iti-treat ng antibiotics kasi dapat yung infection yung iti-treat mo, hindi yung contamination. Kasi if yung contamination, nag-i-introduce ka na naman ng antibiotics for that, which will lead to necessary use of antibiotics. Next is step 8, treat infection, not colonization. We all know na we have our own indigenous microbiota and there are naturally living microorganisms in our body. Ang meaning ng step 8 is hindi mo iti-treat yung natural microorganisms na nandun kasi they do not possess harm naman and unless may symptoms. Ang i-treat mo lang is yung infection kasi yun yung na-diagnose and na pag-usapan within the physician na dapat i-treat. Kasi just like the first one sa treat infection at contamination, mag-i-introduce ka na naman ng unnecessary use of antibiotics which will contribute to the antibiotic resistance without any clinical benefit. Next is know when to say no to vancomycin. We all know that vancomycin is a strong antibiotics and usually used as a last resort. And treat infection cure at in a healthcare setting, dapat hindi tayo unless yun na talagang option. We should know all the interventions, all the steps before magsettle sa pinaka-last, which is vancomycin. And there should be fewer patients na kailangang mag-vancomycin kasi we all know that there is a problem with antimicrobial resistance worldwide. Next is stop antimicrobial treatment stop antimicrobial treatment if tapos na yung cured na yung infection, negative na yung cultures, and basta wala. Stop mo na. Kasi it's unnecessary. Next is prevent transmission, isolate the pathogen, and then step 12, break the chain of contagion. For step 11 is contain the infectious body fluids such as kunyari, the airborne droplet and contact precautions are the types of or mode of transmission. So, if you have if symptomatic ka, diba you isolate yourself kasi para hindi siya mag-spread to other person. And it all depends on with the discretion of the healthcare facility where you're in. Next is break the chain of contagion. Stay at home when you are the health worker. Stay at home if sick ka. And always practice proper hygiene, keep your hands clean, and mag-mask, and be an example to others. So these are the types or modes of transmission. We have 3 types: contact transmission, droplet transmission, and airborne transmission. For contact transmission, there are 2 types, which is indirect and indirect. For indirect, ito yung type of transmission na kailangan, diretso. Like, kunyari ako, infected ako, tapos na-infect ko agad si Beneth. That's in space direct. Kasi there's no need for another person or an object na contaminated in order for her to be infected. Next is indirect, which is walang space. Indirect, it's in type of transmission na kailangan ng person or object before ma-infect yung another person. Example, I have a disease or infection. Tapos, hinawakan ko to. tapos inubuhan ko and something like that. Tapos, na-access siya ng bata. Kunyari, kinuha ng bata, tapos kinain niya or something. That's an example of indirect contact kasi may involved na object or it can also be a person. Next is droplet transmission. For droplet transmission, these are usually when sneezing or coughing. Respiratory droplets na nagkikarry ng pathogens, and droplets are defined as larger than 5 nanometers in size. And then lastly is airborne transmission, which is airborne droplet nuclei or small particles containing pathogens. So, nasaan siya? Nasa air. And then, palutang-lutang. So, if may inhale mo siya, then that's the problem. Kasi it's airborne. Okay, I will give the next report to Genrix.
So I will be discussing most common types of care-associated infections. So these are the infections acquired while receiving treatment in a healthcare facility such as hospitals and clinics. So according to Center for Disease Control and Prevention, these are the 5 common types of healthcare associated infection in the U.S. hospitals. So number one is the Clostridium difficile associated with gastrointestinal diseases. So it is an anaerobic, spore forming and a gram-positive bacillus, which makes them thrive in an environment where oxygens are insufficient and which they can be resistant to standard cleaning and disinfection techniques. So this bacterium is produces toxins that can damage our intestines, leading to symptoms like antibiotic associated diarrhea, and if it is not treated, it can proceed to a serious inflammation to the colon. So if a patient is on a long-term antibiotic treatment, they are in the higher risk of getting the infection because the antibiotics disrupt the normal gut flora of a person, so allowing the C. difficile to multiply and produces toxins. So number two is the UTI, urinary tract infection, most of which are the catheter related because the urinary catheter which is inserted into our bladder may nagpo-form na biofilms around the catheter which makes the pathogens enter our bladder which can cause infection. So for the surgical site infection, these are the occurs of the sites of surgery after a procedure. So when a bacteria enters our body during surgery, it enters through incision, which leads to infection in our skin, tissues, and other things are deeper organs. Example of these pathogens are the Staphylococcus aureus and the Enterococcus species. So they can delay the healing process of a person after surgery, and sometimes they can lead to more serious complications such as the abscesses of formations of or sepsis. Number four is the lower respiratory tract infection, primarily pneumonia. This type of infection in patients who are on a mechanical ventilators or yung mga patients with pre-existing lung conditions where bacteria enter our lower respiratory tract, causing inflammation and infection to the lungs. So, mga pathogens, most common pathogens that can um, enter the lower respiratory tract are the Klebsiella pneumoniae and of course Staphylococcus aureus, and they present symptoms like coughing, fever, and shortness of breath and chest pain. So if they are not treated properly, they they can lead to respiratory failure. And for number five, the bloodstream infections, septicemia. These are the bloodstream infection occur when a bacterium or a fungi enters our bloodstream, often through IV lines and catheters or other invasive devices used in a clinical or hospital setting. So, most common pathogen includes the Staphylococcus epididymis and the Staphylococcus aureus, which they colonizes the IV lines and the catheters, which they create biofilms, causing and leading to infection. So the patient most at risk for healthcare-associated infection, the immunosuppressed patient due to their age, underlying diseases, and medical or surgical treatments, and most especially highest infection rates are found in the ICU because due to their severity of illness and frequent use of invasive procedures and longer hospital stays. So, examples of these vulnerable groups are the elderly patient because of their age, their immune system weakens and they are prone to infection. For premature infants, they are still undeveloped immune system, which makes them highly susceptible to infection. Cancer or transplant patient, they undergo chemotherapy which suppresses the immune system. And for patients with undwelling devices, those with catheters, implants, or tubes are at higher risk because these devices can act as entry point of pathogens. So the major contributing factor to healthcare-associated infections are the following. Number one is the increasing number of drug-resistant pathogens. So, over time, many bacteria, viruses, and fungi had evolved to become resistant to commonly used antibiotics and antimicrobial agents. These drug-resistant pathogens make infection harder to treat, which can lead to prolonged recovery times and increases the risk of spreading in a healthcare setting. So the impact of this is that this leads to superbugs that are resistant to multiple drugs, making them more difficult to eradicate in hospital, where patients are often vulnerable to infection. Number two, the failure of healthcare personnel to follow infection control guidance because these infection controls, such as proper hand hygiene, sterilization of instruments, and the use of personal protective equipment, plays a crucial role in preventing the spread of infection in the healthcare facility, which when the healthcare provider fails to follow these procedures, this This contribute to the risk of healthcare-associated infection. Even small lapses like forgetting to wash their hands during or in between patient interaction and improper sterilization of medical and surgical equipments. This could lead to the spread of pathogens and, of course, the development of healthcare-associated infection. Number three, an increased number of immunocompromised patients. So many patients in the healthcare setting are immunocompromised. So this, which means their immune systems are weakened due to their medical condition, such as cancer and medication, which is they undergo chemotherapy, which weakens their immune system, and procedures like organ transplant. Um, Immunocompromised patients are less able to fight these infections, making them more prone to healthcare associated infections. So, with an increase of patient in this category, which are the immunocompromised patient, hospitals must implement extra precautions to prevent infection. Even a minor exposure to a pathogen can result in a severe and life-threatening infection to this patient. So additional factors that contributes to healthcare-associated infection, the overuse of microbial agents, because misuse of antibiotics can develop to resistant pathogens when antibiotics are excessively used or inappropriately, they kill off susceptible bacteria but leave resistant strain which they are leaving to thrive and multiply. So lengthy surgeries, long surgical procedures increases the time the patient to expose to a sterile environment. So longer surgeries increases the risk of surgical site infection, which I discussed earlier, and other complications that can lead to infection. Overcrowding, especially in hospitals or public hospitals, reduces the ability to maintain a proper hygiene and infection control, which is makes difficult to isolate um, infected patients and can lead to increase of infectious diseases and which causes healthcare associated infections. Improper use of medical devices such as catheters, ventilators, and IV lines are not maintained properly. They become an entry point for pathogens, which can cause infection. Example of this are the urinary tract infection from the usage of catheter, bloodstream infection from IV lines, and ventilator-associated pneumonia. The role of medical devices in healthcare-associated infection, indwelling medical devices such as catheters, ventilators, and more bypasses the natural defenses. So these these medical devices bypass the body's natural barriers like our skin, which normally protect us against infection. So these devices provide a direct pathway for pathogens to enter our body. So from the catheter, so pathogens may form biofilms around the catheter, which may be the mode of entry of pathogens to enter in our bladder and causes infection. Number two, devices must be removed as soon as feasible to reduce infection. So the longer the device remains in our body, the higher the risk of infection. So reducing the duration of device use can significantly lower the spread of infection like catheter-associated urinary infection and central line-associated bloodstream infection. Next. So prevention for health-associated infection. Number one is the compliance with infection guidelines. So the most common and most important method, hand washing. This is one of the most important because it reduces the spread of infection in between interaction with patient and proper disinfection and sterilization techniques. Number two is the hand hygiene. So hand washing before and after specific activities. Example of these are eating, treating wounds. So we need to wash our hands in between treating patients because we may transfer the infection from that patient to another patient we will forgot hand washing or proper wearing of protective gears. So technique, warm water, soap, and scrub for 10 to 15 seconds. And other measurements such as air filtration, isolation, and of course the use of personal protective equipment like gloves, masks, and gowns. So the clinical application of preventing healthcare associated infection. Number one is identifying the high-risk patient, elderly, immunocompromised, and those with invasive devices because identifying the high-risk patient early allows the healthcare team or the healthcare professionals to implement additional protective measurements such as frequent monitoring, the use of sterile technique, and the early removal of devices when no longer necessary are a type of preventing the spread of healthcare-associated infection. Implementing protocols such as use of evidence-based practice like hand hygiene, sterilization, and antimicrobial stewardship. So preventing HAIs requires the strict implementation of these evidence-based practices that reduces the spread of infection. So by following this simple and standard procedure infection control, um, we can significantly reduce the number of infected infections in the healthcare setting. So, tailored intervention, the use of surveillance data to target the most common HAIs, such as the surgical site infections and the urinary tract infections. So, we all know that not all healthcare facilities face the exact same healthcare associated infection challenges. So we need intervention that is customized based on the local data and the infection trends. For example of this is not in this hospital the infection is on the use of catheter, but on other hospital the infection that is really thriving is the bloodstream infection. So we need to adjust the the prevention based on the local data. So by analyzing the data from each local health, healthcare providers can easily target the resources and efforts towards preventing the most frequent infection. So training and compliance, regular staff education on protocols and maintaining adherence. So regular and ongoing staff education is crucial that all healthcare workers are up to date on the latest infection control protocols. So hospitals often conduct training sessions for all healthcare personnel and the use of compliance in monitoring to ensure that the staff adhere these protocols to prevent infection, which helps to prevent lapses that could lead to the spread of infection. And lastly, the multidisciplinary approach, collaboration across department to prevent the infection spread. So, in preventing a healthcare-associated infection, collaboration across various departments within a healthcare facility is a must because it involves the physician, as nurses, and infection control specialists, microbiologists working together to implement a comprehensive infection prevention controls and measurements. So, for example, the microbiology lab may quickly identify pathogen causing infection. So, the nursing staff will ensure that patients, each patient's room devices are properly sanitized. So, that is a work of collaboration, which is a team-based approach in helps sharing a expertise and responsibilities, ensuring that all angles of infection prevention control are covered. Proceed to the next slide, which is the infection and prevention control, which be discussed by Ms. Beneth de Jesus.
So for the infection and prevention control. So infection control designed to break various links in the chain of infection from the word itself, control, para makontrol natin yung pagkalat ng infection, para hindi as a nurse, syempre, as a nursing student tayo, magiging nurses tayo in the future, magagamit natin 'to para hindi natin mapakalat lalo yung, sakit sa ibang pasyente natin. Kasi siyempre lumilipat tayo from, person to person, lumilipat tayo ng ibang pasyente. So, maaari natin silang mahawa. So, for the asepsis means ang meaning nito is without infection. Includes any actions referred to as aseptic techniques. So, in short, parang, simple explanation is malinis lang, malinis. So, there are two types of asepsis, which is the medical asepsis and surgical asepsis. So, for the aseptic techniques, practices that protects patient from healthcare-associated infection as well as the healthcare workers. So, syempre, hindi lang naman natin pinoprotektahan yung mga patients natin, pinoprotect din natin yung ating mga sarili kasi tayo yung nagbibigay sa kanila ng care. So, kailangan alagaan din natin yung sarili natin. Next slide. So, for the history, si Joseph Lister, 1827 to 1912, made contributions in the area of antisepsis means against infection, and asepsis means without infection. He instituted practice of using phenol as antiseptic to reduce microbial contamination of open surgical wounds. Because phenol is quite toxic, it is replaced by other aseptics. Yung phenol is because of its irritant and corrosive properties and potential systemic toxicity. At present, phenol is not commonly used hindi na siya commonly used. So, ang pinalit na sa kanya is sodium hypochlorite para ma-disinfect yung mga instruments natin. And syempre ang usual na ginagawa natin ngayon is yung i-steam siya and autoclave para mawala yung mga pathogen na mag-transfer. Kasi syempre, ang mga instrument naman is dinidisinfect lang siya. So kasi syempre hindi naman natin tapon yung mga instruments na ibang instruments. So i-disinfect natin siya para hindi siya mahawa from person to person, para hindi siya mahawa pag gagamitin na siya sa ibang patient. So, for the medical asepsis, it is a cleaning technique to reduce the number and transmission of pathogen. Katulad nga sabi ko kanina, prevent direct transfer of pathogen from person to person. And indirect transfer of pathogens through air or instruments, bedding, equipment, and other inanimate objects, yung mga sinusuot natin, pwedeng makahawa yun sa iba. Kaya pag galing ospital, dapat palit agad ng damit para hindi na natin siya mahawa sa family natin, para maiwasan natin yon. So, syempre gagawin natin ang hand washing. So, i-discuss natin to sa next slide. So, next slide. So, for the disinfection, chemical sterilants kill bacteria spores with prolonged exposure times, 3 to 12 hours. So, there are 3 healthcare disinfectants. So, first is the high-level disinfection. Kill microbes including viruses except large number of bacteria spores. So, ginagamit siya sa semi-critical items that will come into contact with either mucous membrane or non-intact skin. These disinfectants are generally only found in healthcare settings to kill endospore-forming bacteria that will cause infection to spread in your facility. Sporicidal disinfectant products are traditionally used in surgical centers or in facilities susceptible to dangerous microorganisms. Since these products include more dangerous ingredients, special techniques and skills are required when handling them within healthcare setting. People who handle these products should wear PPE and spill kits available to them before using the products. So, ang disinfectant products na to ay combination siya ng bleach and hydrogen peroxide or a blend of peracetic acid and hydrogen peroxide. The most active ingredients are peracetic acid, hydrogen peroxide, glutaraldehyde, hypochlorous acid, hypochlorite orthotaldehyde. So for the intermediate level disinfectants naman, kill mycobacteria, vegetative bacteria, most viruses, and most fungi, but not necessarily kill bacteria spores. So ang intermediate level disinfectant is used to disinfect some critical items and some non-critical items that can potentially be on you. In healthcare settings, this typically means clothing, scrubs, or workwear that may come into contact with problematic bacteria, infectious material, or even blood-borne pathogens. So yung mga solution nito is quat and alcohol blends. These are able to attack pathogens like norovirus and mycobacteria. Yung bleach naman is often used to disinfect clothing worn in healthcare setting. This attacks mycobacteria, small viruses, and some bacterial spores. So for the bleach and hydrogen peroxide blends, these blends attack more complex bacterial spores than bleach alone. So handling intermediate level disinfectants requires care, correct dilution rates, and proper personal protective equipments including mask, gloves, yung mga PPE. Kailangan natin yon para maprotektahan tayo. So for the low level disinfection, kills most vegetative bacteria, some fungi, and some viruses within 10 minutes of exposure. So these are used to disinfect non-critical items that come in contact with skin. This includes shared patient care devices katulad ng mga thermometer, yung BP, yung cuff doon. Kasi pwede, di ba, gagamitin natin sa pasyente na ito, tas hindi natin lilinisin, di nahawa siya kung may sakit man sa balat yung unang pinagamitan natin, di ba? Then yung mga yung bed rails, kasi syempre iba-iba yung humihiga doon, napapalit-palit ng patient. Tas, pwede natin gamitin yung mga wipes or alcohol kasi nakakapatid din naman yon. So, hindi naman siya required na intensive cleaning kasi nga pwede naman siya ng alcohol. So, quaternary ammonium compounds, often referred to as quats, yung sabi ko kanina, pwede rin tayo gumamit ng hydrogen peroxide and sodium hypochlorite para ma-disinfect natin yung mga ginamit natin. And pwede rin siya sa waiting rooms and exam rooms, able to kill fungi, amoebas, molds, many types of microbes, and most viruses. Quats are an ideal choice for low-level infection. So 30 years ago, devised a system of classifying instruments and items for patient care according to the risk of infection that was involved. So by Earl H. Spalding. So critical items, high risk for infection, katulad ng sabi ko kanina, and the semi-critical items contact mucous membranes and require high level of disinfection. So for the non-critical items, contact with intact skin but not mucous membrane. Katulad nga kanina na sabi ko, yung mga blood pressure cuffs and yung sa bed rails. So for the surgical asepsis, sterile techniques keeps object and area sterile to exclude microbes. Katulad ng surgical scrubbing of hands, katulad nung yung 1, 2, 3, 4, 5 na hand washing, yun. Isa siya sa surgical asepsis. At pagsusuot ng mga PPE, katulad ng scrubs, ng gloves, ng face mask, shoe covers, para mapanatili na katulad sa OR, para hindi makapasok dun yung possible na pathogens or microorganisms na nakaka-affect dun sa inoperahan. Kaya kailangan natin to using sterile solutions and dressings para naman sa sa paglinis ng instruments, using sterile drapes and creating a sterile field. Napaka-importante nito kasi katulad nga ng sabi ko kanina, para hindi magkaroon ng possible na contamination na makaka-affect dun sa patient na inooperahan. Kasi possible na mag-lead yun sa death kung ganon. So heat sterilize surgical instruments, practice in operating rooms, labor, and delivery area, especially invasive procedures. So, during surgery, magsuot tayo ng basta yung parang net na parang may color blue, iba-ibang color, then tatali natin siya para hindi malaglag yung hair natin kasi possible na contaminated din siya kasi syempre galing tayo sa labas, nagbiyahe tayo, possible na kumalat yun sa loob kaya kailangan nakatali siya tapos naka-handcuff tayo. Patient skin must be thoroughly cleansed and scrubbed with soap and antiseptic. If extensive, surrounding area is covered with sterile plastic film or sterile cloth drapes. The surgeon and all surgical assistants must scrub their hands for 5 to 10 minutes with disinfectant soap. Ayan yung mga antibacterial soap, yung katulad ng safeguard, ganon. Tapos, importante na gagawin natin yung 1, 2, 3, 4, 5 technique ng hand washing, tapos pagsa-scrub para wala talagang matira ng microorganisms or possible na makahawa. So, cover their clothes, mouth, and hair. These coverings include sterile gloves, gowns, caps, and masks, with shoe covers being considered optional. So, regulations pertaining to healthcare epidemiology. Important regulation was published in 2001 by the Occupational Safety and Health Administration, or OSHA, which is bloodborne pathogen standard. This standard requires facilities having employees who have occupational exposure to blood or other potential infectious materials to prepare and update written plan called exposure control plan. This plan is designed to eliminate or minimize employee exposure to pathogens. Kasi syempre nga, dapat pa rin naman natin alagaan yung sarili natin kasi isa tayo sa mga nagbibigay ng care sa ating mga patients. So, hindi tayo pwedeng magkasakit din. So, next slide please. So, standard precautions, which is, ito yung pag-hand hygiene. Katulad sabi ko kanina, pag-hand hygiene, magsusuot ng mga PPE. Next slide please. Ito yung di-discuss din natin later. So, for the vaccination, bago tayo syempre sumabak sa humarap sa patient, kailangan din natin magpa-vaccine para maprotektahan din tayo sa possible na makahawa sa atin. Which is the hepatitis B vaccine, influenza, measles, mumps, rubella. Pag bata ka pa lang, like ilang months ka pa lang, itinuturok na to lalo na yung MMR, yung polio. Tinuturok na siya pag bata pa lang para ma-protectionan na agad yung bata sa paligid niya. So yan, katulad nga kanina sabi ko, standard precautions, yung pag-hand hygiene. Yan. Si Ignaz Philipp Semmelweis, 1818 to 1865, the father of hand washing, a Hungarian physician that is assigned in maternity department and discovered that puerperal fever that women develop was caused by cadaverous particles present on the hands of physicians and students. He made a rule whoever's entered for examination must wash their hands with chlorinated lime in the basin near the entrance of wards. So, ayun nga, magsusuot natin ng PPE, gloves, napaka-importante nito kasi paghahawak tayo ng mga mucous membrane or intact skin, kailangan yan. Then, next slide please. Isolation gowns para hindi kasi syempre galing tayo sa labas. Para maproteksyonan yung ating damit, para maproteksyonan din yung patient natin. It protects healthcare providers' arms, tayo rin. Syempre tayo mga healthcare providers. Then for the mask, pag kunyari may blood na kumalat or nag-spill galing sa patient natin, hindi tayo mahawa ng possible mga sakit dun. Respiratory protection para ma-filter yung airborne particles. Eye protection, katulad nga sabi ko kanina, para hindi rin tayo magka-infection sa eyes kasi syempre pag tumalsik yan, kakalat din sa buong katawan natin, magkakasakit pa tayo. Patient care equipment, organic materials such as blood must be removed from the medical equipment, must clean materials such as thermometer to prevent cross-contamination. Ito nga nasabi ko kanina. Environmental control, healthcare provider must comply with adequate procedures for the routine care, cleaning, and disinfecting of environmental surfaces. So, linens, dapat pinapalitan natin siya para sa next na gagamit ng patient. Disposal of sharps, napaka-importante nito. Dapat pagka turok natin or paggamit natin ito, i-dispose natin agad siya sa proper receptacle para hindi magkahawa-hawa kung possible na nahawakan. Dapat pag itatapon mo siya, proper din yung paghawak mo para hindi din dumikit sa'yo, kaya tayo may gloves. For the next slide, which will be presented by Miss Julianna.
Okay, so for transmission-based precautions naman, this table shows the types of transmission-based precautions and the infectious disease or conditions that requires that type of transmission-based precaution. So there are 4 types of transmission-based precautions, namely contact precautions, contact enteric, droplet precautions, and airborne precautions. So these can either be used singly or in combination. So for contact precautions, the diseases under it are oozing cellulitis, open wounds, uncontained urine, uncontained respiratory secretions, diarrhea, RSV, MDRO or multi-drug resistant organisms, and cystic fibrosis. Under contact enteric, Clostridium difficile and norovirus infections. Under droplet precautions naman, influenza, meningitis, mumps, pertussis, and viral hemorrhagic fevers. Under airborne precautions, measles and tuberculosis. And then under airborne and contact precautions, chickenpox and shingles. Next. Ayan. So as what I stated earlier, transmission-based precautions are used for patients who are known or suspected to be infected or colonized with highly transmissible pathogens for which additional safety precautions beyond standard precautions are required. So yun nga yung 4 types of transmission. So let's start with contact precautions. Contact transmission is the most frequent mode of transmission of HAIs or yung health care associated infections. Contact precautions are used for patients known or suspected to be infected with pathogens that can be transmitted by direct or indirect contact. So contact precautions are instituted whenever there is a chance of the patient soiling the environment through yung mga infectious diseases na mention ko earlier, such as uncontained diarrhea, poor cough control, or when the patient has draining wounds. Examples of infections agents requiring contact precautions include multi-drug resistant bacteria, respiratory viral infections such as scabies, impetigo, chickenpox, or shingles. So, ito yung contact precautions. Ayan. Before entering the room, dapat may hand hygiene requirement then yung gown and gloves to enter the room, and then upon exiting, you should also perform hand hygiene. Next. For contact enteric precautions naman, these are used whenever a patient has C. difficile or norovirus infection and signifies that the healthcare worker needs to use soap and water for hand hygiene rather than just an alcohol-based product. So this is the contact enteric precautions actions to be taken under contact enteric precautions. So hand hygiene before entering the room, gown and gloves are required to enter the room, and the use of soap and water for hand hygiene upon exiting the room. Next. For droplet precautions naman, These must be used for patients known or suspected to be infected with microbes transmitted by droplets. So droplets are produced primarily as a result of coughing, sneezing, and talking, as well as during hospital procedures such as suctioning and bronchoscopy. Transmission occurs when droplets containing microbes are propelled in a short distance through the air and become deposited on another person's conjunctiva, the eye area, nasal mucosa, the nose area, or the mouth. Because of their size, droplets do not remain suspended in the air, um, unlike airborne precautions. Unlike airborne transmission, rather. So, ayan. These are the actions to be taken under droplet precautions. So, similar sa contact and contact enteric, hand hygiene before entering the room, requirement ang mask with eye shield or regular mask to enter the room, and hand hygiene as well upon exiting the room. Next. For airborne precaution naman, this is applied to patients known or suspected to be infected with pathogens that can be transmitted by the airborne route, such as tuberculosis or measles. Airborne droplet nuclei are small particle residues of evaporated droplets containing microbes. Because of their small size, they remain suspended in the air for long periods. So, ayun, dahil maliliit nga yung particles ng under airborne transmission, they suspend in the air unlike droplet transmission. So, ito yung actions to be taken under airborne precautions. Hand hygiene before entering the room, required ang N95 or HEPA or PAPR respirator mask, as well as the use of negative air pressure to keep while the door is closed, and hand hygiene as well upon exiting the room. Next. Ayan. So, for patient placement naman, there are two types of patient placements, namely the AIIR and the protective environment. So, what is patient placement muna? Whenever possible, single patient rooms are used for patients who might contaminate the hospital environment or who do not assist in maintaining appropriate hygiene or environmental control. So single rooms are always indicated for patients placed on AIIR or airborne precautions rather, and are preferred for patients requiring contact or droplet precautions. So for the first type of patient placement, airborne infection isolation rooms or AIIR. This is the preferred placement for patients who are infected with pathogens that are spread via airborne droplet nuclei. They require AIIR. So an AIIR is a single patient room that is equipped with special air handling and ventilation systems. These types of rooms are under negative pressure to prevent room air from entering the corridor when the door is open. And air that is evacuated from such room passes through HEPA filters or high-efficacy particulate air filters to remove any pathogens. So to reiterate, AIIRs are under negative pressure, and air that is evacuated from these rooms passes through HEPA filters. So kita naman sa image on the right how the AIIR works. So basically, yung air from the room cannot enter corridors without passing through HEPA filters. So yung air from the corridor can enter the room, pero yung palabas na air dapat mag-pass through muna the HEPA filters before mag-circulate ulit yung air. Next. For protective environments naman, this is sometimes referred to as protective isolation or positive pressure isolation. It is a well-sealed single patient room in which vented air entering the room is passed through HEPA filters. The room is under positive pressure to prevent corridor air from entering when the door is open. So unlike the AIIR, ito naman, bawal pumasok yung air from the corridor inside the room. Rather, yung, ayun nga, these are under positive pressure and vented air that enters these rooms passes through HEPA filters. So yung air from the corridor should pass through the HEPA filters first before pumasok sa room yung air na yon, and then yung the air from the room can pass through the corridors naman. So parang baliktad lang sila ng AIIR. So yeah, to reiterate ulit, protective isolation environments or protective environments are rooms under positive pressure and vented air that enters these rooms passes through HEPA filters. So next na. So these are the precautions to be done under protective isolation environments. Strict hand hygiene before entering the room and when leaving the room. And persons with runny nose or cold-like symptoms should not enter the room. If absolutely necessary, a surgical mask must be worn. No fresh flowers or plants are allowed as well. So do not place patient in negative pressure room kasi dapat sa for AIIR yan, this is protective isolation. And that's all for this part. To continue, Miss Rayna will proceed.
So for today, I will be presenting handling food and eating utensils. Contaminated food provides an excellent environment for the growth of pathogens. So contaminated food can lead to the growth of harmful pathogens, which can cause foodborne illness. To prevent this, it's important to follow some straightforward regulations for safe food handling and maintaining clean eating utensils. First is using high quality fresh foods. Lagi natin tatandaan na always choose fresh ingredients para ma-minimize yung risk of contamination because quality matters. So check natin lagi yung mga expiration date and avoid damaged or spoiled items. Next is properly refrigerating and storing food. So store food correctly by refrigerating perishable items promptly and make sure na yung fridge is nakaset siya sa right temperature to slow down bacterial growth. Next is properly washing, preparing, and cooking food, properly disposing of uneaten food, thoroughly washing hands and fingernails before handling food. Why? Because cleaning your hands and nails before preparing or serving food is a simple step that can significantly reduce the risk of transferring germs. And providing periodic health examination for kitchen workers because regular health checkup those working in food preparation areas can help catch any potential health issues that could compromise food safety. So next slide. Handling fomites. Fomites are any non-living or inanimate objects other than food that may harbor and transmit microbes. Fomites are objects that can carry and transmit germs. Ito yung sinasabi ni Sir na makikita natin sa mga objects na naninirahan yung mga germs or bacteria. So posing a risk of infection. To minimize the transmission of pathogens through these surfaces, it's important to follow some key practices. So first is use disposable equipments and supplies wherever possible. By doing this, pwede niyang ma-reduce yung risk of cross-contamination na ulit-ulit nating sinasabi mula una ng report since these items can be thrown away after use. Next is disinfect or sterilize equipment as soon as possible after use. Use individual equipment for each patient. Why? Because whenever feasible, provide separate equipment for each patient, because this practice helps prevent the transfer of germs from one individual to another. And lastly, use electronic or glass thermometers. By using electronic or glass thermometers rather than traditional mercury ones, these options are generally easier to clean and less likely to harbor bacteria. Next slide, please. Medical waste disposal. Materials or substances that are harmful to health are referred to as biohazards, short form of biological hazards. According to OSHA standards, medical waste must be disposed of properly. These standards include the following: any receptacle used for decomposable solid or liquid waste or refuse must be constructed. Why construction of receptacles are included? Because any receptacle used for these from durable materials can prevent leaks and spills. Next is all sweeping, solid or liquid waste, refuse and garbage shall be removed. It is ginagawa siya safely removed from medical facilities para ma-minimize din yung hazards na mangyayari. And last, the Medical Families Infection Control Program must address the disposal of potentially contaminated items. So, medical facilities have an infection and disposal of potentially contaminated items, ensuring proper procedures are followed to protect both workers and the public. Next slide. Control in dental healthcare settings. In dental-related programs such as dental assistant, dental hygienist, and dental laboratory technicians should familiarize themselves with these guidelines. The following are some of. Next slide. Infection prevention and control committees and infection control preventionists. The primary responsibilities of an ICP are as follows: possess knowledge of infectious disease process, reservoir, incubation periods, periods of communicability of patients, conduct surveillance and epidemiologic investigation, prevent, control, and transmission of pathogens. Why? Because to prevent and control the spread of pathogens within the dental facility, this may include protocols for sterilization, manage the facilities infections control program, and evaluate new medical products that could be associated with increased infection risk. Next slide, please. Role of the microbiology laboratory in healthcare epidemiology. The microbiology laboratory plays a crucial role in healthcare epidemiology and infection control. And here are some key ways in which lab personnel contribute. First is monitoring the types and numbers of pathogens isolated from hospitalized patients. The lab tracks the types and quantities of pathogens found in hospitalized patients. The monitoring helps identify trends in infections and outbreaks, allowing for timely interventions. Next is performing antimicrobial susceptibility testing, detecting emerging resistance pattern. Sa pagdedetect ng pattern of resistance, nakakatulong siya sa healthcare providers to choose the right treatment and interventions and adapt strategies to combat resistance infection. Notifying the appropriate ICP should unusual pathogen or an unusually high number of isolates of a common pathogen to be detected. Next is by processing environmental samples. And lastly, by performing biochemical, immunologic, and molecular identification and typing procedures to compare various isolates if the same species. By using biochemical, immunologic, and molecular techniques, the lab can identify and classify different isolates of the same species. This comparison is nakakatulong in tracking the sources of infections and understanding how they spread within the facility.
So we are now in chapter 13, which we will be discussing diagnosing infectious diseases. The outline for this topic are the following: clinical specimens, the pathology department, which has two major divisions, the anatomical and clinical, and then lastly is the clinical microbiology laboratory, which is the main focus of our topic. So these are the examples of clinical specimens which we can be collected to a client or a patient. So all of this will be tackled in the next few slides. So this is the diagrammatic representation of the steps involved in the diagnosis of infectious diseases. So first, if yung patient is nakakaramdam ng symptoms of an infectious disease, they go to a healthcare center like a hospital or clinic and they consult a clinician. Next niyan is the clinician makes a preliminary diagnosis and mag-order siya ng laboratory test. Some laboratory tests needs a physician's order and some naman hindi. Ang example na kailangan ng physician's order are I think CBC as well as the HEPA B titer, which is the anti-HBs. Next is after nun, after magbigay ng physician's order, mapakolect na ng specimen, appropriate specimen sa patient. And then after makolect, by observing aseptic technique, ipapadala ito sa laboratory and appropriate laboratory kung saan siya itetest. Specimen and data are then logged in a computer or a logbook kasi kailangan ma-identify kung kaninong galing ang specimen na to, for what procedure, and most important is ang viability niya, kung kailan lang siya pwede and hanggang kailan lang. And then next is specimen is examined macroscopically and microscopically. After that, gagawa na ng presumptive report. It can be issued by the physician or the one directing the laboratory. If hindi na kailangan ng another test, ang clinician is gagawa na ng report to prescribe a treatment. If kailangan ng more tests, is ang specimen na yun will be cultured, incubated, and then examined for, and if kailangan is subculture din siya. After that is magkakaroon na ng definitive identification of systems and pupunta na rin siya sa step na kung saan i-interpret ng clinician and gagawa ng prescription for the treatment. After that, if may treatment na yung patient, that patient will be monitored and evaluated if ang binigay na treatment ng clinician is a failure or effective. Next will be discussed by Julianna Barrera.
So for the role of healthcare professionals in the submission of clinical specimens, collection and transport should be with extreme caution to avoid needle stick injury, cuts, or contact with any type of specimen. They should adhere to standard precautions. A close working relationship among the members of the healthcare team is essential for the proper diagnosis of infectious diseases. When a clinician suspects that a patient has a particular infectious disease, appropriate clinical specimens must be obtained and certain diagnostic tests are requested. The doctor, nurse, CLS, or medical technologist or other qualified healthcare professional must select the appropriate specimen, collecting it properly, and then transport it properly to the CML for processing. The laboratory findings must then be conveyed to the attending clinician as quickly as possible to facilitate the prompt diagnosis of and treatment of the said infectious disease. Although lab professionals do not themselves make diagnosis, they make laboratory observations and generate test results that assist clinicians to diagnose infectious diseases and initiate appropriate therapy. Next. And so according to the Clinical and Laboratory Standards Institute, specimens should be collected using aseptic technique, which was discussed earlier, placed in or transferred into a leak-proof primary receptacle with a secure closure. screw closures are preferred. The person collecting should not contaminate the outside of the primary receptacle, and the primary receptacle should be placed in a sealed, leak-proof secondary packaging, which will contain the specimen if the primary receptacle breaks or leaks in transit to the lab. Next. So for the importance of high-quality clinical specimens naman, basically, ito yung three na parang gusto niyang i-achieve. So first is to achieve accurate results, clinically relevant results, and to provide information about the patient's infectious disease. Quality laboratory work equals quality of specimen received. So high-quality clinical specimens are required to, again, achieve accurate, clinically relevant lab results, meaning the results that truly provide information about the patient's disease. It has often been stated that the quality of the laboratory work performed can only be as good as the quality of the specimen it receives. So ayan. It is possible for a CML to obtain and report high-quality test results if the laboratory receives poor quality specimens or the wrong type of specimens. High-quality clinical specimens are required to achieve accurate, clinically relevant lab results. The three components of the specimen quality are proper specimen collection. The correct type of specimen must be submitted to the laboratory. B, proper specimen collection. And C, proper transport of the specimen to the laboratory. So, further discuss pa yan sa next slide. Next po. Ayan. So, if clinical specimens are improperly collected or handled, the etiologic agent or the causative agent may not be found or may be destroyed. Overgrowth by indigenous microbiota may mask the pathogen and or contaminants may interfere with the identification of pathogens and the diagnosis of the patient's disease. Next po. Yeah. So for proper selection, collection, and transport of clinical specimens, the specimen must be properly selected. So the appropriate type of specimen should be used for the diagnosis. Next, properly and carefully collected in a manner that will eliminate or minimize contamination of the specimen with indigenous microbiota. Next is the material should be collected from a site where the least contamination is likely to occur. Specimens should be obtained before antimicrobial therapy has begun. And then the acute stage of the disease is the appropriate time to collect most of the specimens. Next. And the specimen must be, specimen collection should be performed with care and tact to avoid harming the patient, causing discomfort, or causing undue embarrassment. A sufficient quantity of the specimen must be obtained to provide enough material for all the required diagnostic tests. All specimens should be placed or collected into a sterile container to prevent contamination of the specimen by indigenous microbiota and airborne microbes. Specimens should be protected from heat and cold and promptly delivered to the lab. Specimens must be handled with great care to avoid contamination of the patient's couriers and healthcare professionals. And the specimen container must be properly labeled and accompanied by an appropriate laboratory test containing test requisition containing adequate instructions. Next. Ayan. So ito yung mga need dun sa label, the patient's name, the hospital identification number and room number, the requesting clinician's name, the culture site and date and time of collection. Ito yung mga requisitions na state ko earlier. Ayan. Name, age, sex, the ID number, name of clinician, site, date, initials of the person who collected the specimen. Next po. Ayan, I also said that earlier. The contamination of clinical specimens with indigenous microbiota. Vast numbers of Microbes live on and in the human body, and they are referred to as indigenous microbiota or human microbiome. Many of these are opportunistic pathogens, thus, when present in specimens, these organisms might mirror, but it is also possible that they are causing infection. So, clinical specimens must be collected in a manner that eliminates or at least reduces contamination of the specimens with members of the indigenous microbiota.
So, earlier, nakita niyo yung table ng mga clinical specimens. So, this is the types of clinical specimen usually required to diagnose infectious diseases. So, first is blood, urine, cerebrospinal fluid, sputum, and other respiratory specimens, throat swab, wounds, and abscess specimens, genital, and fecal. So, let's start with blood. So, blood specimen is sent to the hematology department. Blood has components such as plasma. Cellular elements are these. Under these are red blood cells, white blood cells, monocytes, and lymphocytes. And then lastly is platelets. So in the blood, there's what we call bacteremia and septicemia. Bacteremia is this presence of bacteria in the bloodstream. And then ang septicemia naman ay mga gram-negative bacilli that causes chills, fever, frustration, and the presence of bacteria on the presence of bacteria or the toxins in the bloodstream. Bacteremia doesn't always necessarily cause symptoms or illness unless there is an overgrowth. And then bacteremia can occur from certain activities like deliberation ng teeth or any other medical procedures. If immune system natin, clear niya yung bacteremia, there's no treatment needed. Septicemia naman, there is a presence of infectious agents in the bloodstream. And this can cause ayong kanina, and then it will progress to sepsis if left untreated. So, sa collect ng blood specimen, there should be 2 to 3 blood cultures or of 20 ml in each collection, and nilalagay siya sa blood cultures, the aerobic bottle and anaerobic bottle. They have their own purpose, and then kailangan yung temperature niya is 30 degrees Celsius only kasi nga, di ba, it's from our body, and our usual temperature body is 37 degrees Celsius. Yun yung proper temperature niya. And on the upper right, may picture ni black. Parang ano siya, parang temperature regulator, parang ref. Hindi siya ref, kasi bawal siyang i-ref. Pero ito yung parang machine para ma-regulate na 37 degrees Celsius lang yung temperature ng blood culture. And additionally, ang blood specimen is nilalagay din siya sa mga yung tubes, yung maliliit. And nakikita niyo naman yun if magpapa-blood draw kayo for laboratory tests. And these blood specimen tubes have their own different purpose. Like, one of the most common is EDTA tube, yung purple. Meron din for heparin tube, for saturated tube, and then for clotting factors or clotting activator. So, we will not delve deeper kasi they're more on the medtech side. So, in blood collection, should be observing aseptic technique. Wear sterile gloves with each patient, hand hygiene, and the location should be this is called the venipuncture procedure. The location is on the vein at the antecubital fossa, yung dito. Dito siya. And clean the site with 70% isopropyl alcohol in a concentric swabbing ng paikot. And then let it dry, and then after mo dry, do not touch the site. Yung site or location ng blood collection should be medtech or healthcare provider should be careful when drawing or performing venipuncture and making sure not to puncture the or use the brachial artery kasi katabi niya lang and or medyo malapit siya sa brachial nerve. And if magkaka-nerve injury, yeah, it's masakit and magkaka-problem yung patient. So, next is urine. So, urine is another specimen na most common na kinokollect sa client or patient. And one of the most common is dahil sa UTI. And we were taught as nursing students, kasi tayo yung mag-instruct or educate sa patient on how to properly collect urine specimen. So, di ba sinabi sa atin na it should be a clean catch midstream urine. Kasi ang distal urethra, at we all have our own endogenous microbiota. So if dun ka sa pinaka-first part ng urine mo, ng ihi mo, is if iihi ka na, madadala yung mga endogenous microbiota from the distal urethra papunta sa specimen, and that could result to a false positive kasi nga hindi nga yun yung kailangang yung kailangang i-test or may mga added na microorganisms from your distal urethra. So dapat should be midstream kasi yun yung parang it's clean. Hindi na siya contaminated ng distal urethra kasi na-wash away na siya from the first part. Urine sample or specimen should be analyzed within 2 hours of collection kasi if beyond that, there could be mga protein na denaturate or mga other components na hindi na makikita kasi sobrang tagal na ng urine. And the next is urine should be refrigerated for 4 degrees Celsius.
So, for the cerebrospinal fluid, ginagawa to diagnose certain neurologic disorders. This may include infections, katulad na meningitis, encephalitis, meningoencephalitis, or rapidly fatal diseases that can be caused by various microbes including bacteria, fungi, protozoa, and viruses. So, yung procedure niya is mag-insert ng needle into the spinal canal, most commonly to collect cerebrospinal fluid for diagnostic testing. The main reason for a lumbar puncture is to help diagnose diseases of the central nervous. So, do not refrigerate.
Additional lang for cerebrospinal fluid or spinal tap, it is done by a physician, not by us. Kasi it is sensitive kasi nga sa spinal area. And then, when it comes to cerebrospinal fluid, it is stat specimen. So, after collection, kailangan send agad sa laboratory. And then, yung critical values, ang mean nito is kailangan di ba, there's a organization or process upon sending specimen and then collecting ng result. So, the critical values over the phone could be discussed between the laboratory and the physician kasi nga stat specimen siya and it is critical. And the next is cultured for, and then ang cerebrospinal fluid is ginagamit for antibiotic susceptibility test.
So, for the sputum and other respiratory specimens, pus that accumulates deep within the lungs of a patient with pneumonia, tuberculosis, or other lower respiratory infection. So, ginagawa to determine whether abnormal cells are present in sputum samples. Then, para makapag-diagnose din kung ano ba yung nagkakos ng infection dito sa lungs or sa airways. So, diagnosing and following up with people who have serious respiratory illnesses such as yun nga, katulad ng sabi ko kanina, baka kasi may infection na siya. Ito yung kinukuha to sa may ubo, ito yung plema. So, ito yung plema, yun yung sputum. So, may be refrigerated. So, proper mouth hygiene is maintained. The sputum will not be severely contaminated with indigenous oral microbes. So, for the throat swab collected to determine whether a patient has strep throat or Streptococcus pyogenes pharyngitis. So, a bacterial infection can make your throat feel sore and scratchy. So, streptococcal bacteria are contagious. They can spread through droplets or when someone with infection coughs or sneezes. Kaya ito yung ginagawa pag if late ako, yung ginagawa siya pang
Swab test.
ayan, para ma-determine kung may sakit pa, like yung COVID nga, para ma-determine kung may COVID-19 ba yung tao. Then, sa wound and absence specimens naman is diagnose skin absence during physical examination. Collect sample of the pus from, ito yung nana. Ito yung nana siya. So, pag ina-examine to, hindi siya sinaswab, ina-aspirate siya para makuha yung sample, yung nana, para malaman kung ano ba yung nagkukos ng mamaga, yung parang ganun kasi itsura niya kung may ito yung skin, tas nakaganyan siya. Ganyan yun, parang nakaangat, ganyan. Ganyan yung itsura niya. So, para malaman kung ano ba yung nagkukos nun. Next slide, please. So, ito namang sa genital and STD specimens, urine or oral genital swab. Usual na ginagawa dito is nag-pap smear. So, sa pagpa-pap smear, is open siya using yung bakal. Papasok siya sa genital area ng babae, then kukuha na sample. Kukuha siya sa cervix. Iikutin niya yung parang hindi siya, parang brush like yung tsura niya, ganon. Tas parang cotton din para malaman kung para malaman kung may sakit ba, kung may STD ba yung babae. Ang babae kasi is ang recommended ng doctor is magpa-check pag 21 years old and above. Like every year siya ginagawa. So dapat ganun siya. So ang usual na nakikita dito is chlamydia, trichomoniasis. So either urethral, vaginal, or cervical swabs or first catch urine can be used in molecular based assay. So pwede ka makapag-test nito hindi lang sa pap smear, pwede rin yung sa ihi. Katulad nga ng sabi ni Miss Cheska kanina. Pwedeng ganun, pwede ma-determine. Marami kasi yan. So, Trichomonas vaginalis as a protozoan is a very common STD. So, fecal specimens process immediately to prevent decrease in temperature, which allows pH to drop, causing death of many Shigella and Salmonella species. So, sa fecal specimens naman, kaya ito kinukuha para malaman kung may problema ba siya sa stomach, sa intestines, sa rectum, or other parts na gastrointestinal system. Nagawa siya para malaman kung may sakit ka ba sa stomach mo or sa intestine. Then, nakaka-help din siya para makapag-diagnose kung may ulcer, may cancer ka. Pini-place din siya pag kumukuha ng fecal, ang tawag dito is, sa procedure is fecalysis. So, piniplace siya in a container with a preservative that maintain a pH of 7. So, ayan nga, in gastrointestinal infection, the pathogen frequently overwhelm the indigenous intestinal microbiota so that they are the predominant organisms seen in smears and cultures.
Now we will be tackling or discussing about the pathology department, or also called the lab. It is directed by a pathologist. A pathologist is someone who has a special training or specialization regarding the study of structural and functional manifestation of disease, which is the pathology. So it can be someone who has a four-year degree program like a medtech or a biologist or a biology graduate na mag-specialize to be GIST. And I think it's 2 years. So, all those specimen na discussed natin earlier, that will be sent to the pathology department or the laboratory. And it depends on which major division siya mag-send. And the two major divisions of pathology department is anatomical pathology and clinical pathology. Difference between anatomical and clinical solely depends on the type or kind of sample that they study. Sa anatomical pathology, there are more on the samples from organs and tissues. And then sa clinical pathology naman, their specimen is usually body fluids like blood, urine, and saliva to diagnose if may infection. Next, in anatomical pathology, nito ay ang ang morgue or kung saan nag-autopsy, ang histopathology laboratory, histopath, dito ina-examine ang tissues ng dito, tissues na may diseases and dito din na-diagnose, like biopsy. Biopsy is malalaman if may cancer or not yung tissue. Next naman is cytology laboratory, and dito tinetest if may abnormality yung tissue or yung specimen. Ang example nito ay yung pap smear earlier for screening of cervical cancer. Next is cytogenetics laboratory. Dito ina-analyze ang chromosomal genetic disorders, and example nito is karyotyping, or karyotyping is for Down syndrome. Next is electron microscopy laboratory para ma-view yung cells or tissues in an ultra-detailed way. And next or last for anatomical pathology is the molecular diagnostic laboratory. Dito ina-analyze ang DNA or RNA ng sample. And ang example ng procedure dito is the PCR testing for COVID-19. For clinical pathology, ito yung I feel like as students, mas dito tayo familiar. Kasi based on the type of specimen na sinasend dito. Especially sa mga medtech. So first is clinical chemistry laboratory or urinalysis laboratory. Dito sinesend ang blood and urine for metabolic function of organ health. Next is hematology or coagulation laboratory. Dito tinitest yung blood components and clotting ability ng blood specimens, such as if magpapa-CBC, magpapa-PP, and also if magpapa-test for clotting disorders. Next is immunology laboratory. Dito, tinitest yung immune response, and dito din malalaman if may autoimmune diseases yung isang tao. Example nito ay for HIV testing and for autoimmune markers. Next, blood bank or immunohematology laboratory. Dito yung blood bank. So, dito na tinatest cross-matching and blood typing for blood transfusions. And then lastly, for clinical pathology is clinical microbiology laboratory, which is focus for this report kasi it involves identification of bacteria, viruses, and fungi, such as use of blood culture if for sepsis, and then throat swab for strep throat. I will be giving the next discussion to Genrix and Rayna.
So for the clinical microbiology laboratory or the CML, it is directed by pathologists, microbiologists, or a medical technologist with years of experience working in microbiology, and it plays a significant role in identifying pathogens and guiding treatment. So under the clinical microbiology, we have the mycology section, bacteriology section, parasitology section, microbacteriology section, TB lab, the virology section, and the immunology section. Next. So for the clinical microbiology, it is a specialized lab that supports clinician in diagnosing and treating infectious diseases. So as I said, it is managed by pathologists, microbiologists, and experienced medical technologists. And it is divided into sections for different microbe categories. Next, please.
So for the four major responsibilities, one is the process clinical specimen. Yung ginagawa dito nag-start yung lab by handling and preparing clinical specimen collected from patients. Nag-involve dito na ensuring ng samples that are properly labeled and stored for accurate analysis. Second is isolate pathogens. Um, this means separating the harmful microorganisms assessed to study them more closely. And third is identify pathogens to the species level. Once na-isolate na siya, the lab works to identify the pathogens down to the species level. This precise identification is crucial for determining the right treatment and management of infections. And lastly, performing antimicrobial susceptibility testing. So, yung information na to nakakatulong sa mga clinicians na mapili yung most effective treatment options for patients. Additional or less frequent responsibility is process of environmental samples. Samples collected from within the hospital environment, floors, sink, nasal swab, open wounds, processed by the CML whenever there is an outbreak or epidemic within the hospital to locate the source of pathogen. So for the general processing of specimen in CML, first is examining the specimen macroscopically. The lab first examines the specimen with the naked eye to look for any obvious signs of infections. And then next is examining the specimen microscopically. This helps in identifying microorganisms that may not be visible sa naked eye. And lastly, inoculating the specimen to appropriate culture media. And finally, the specimen is inoculated onto appropriate culture media, and this step encourages the growth of any microorganism present, allowing for further study and identification.
So for the isolation and identification of pathogens, number one, an effort to isolate bacteria, including microbacteria and fungi such as yeast and molds, from clinical experiment. The specimens are inoculated into liquid and culture or onto solid culture media. Example is when a patient sample such as blood, urine, or sputum, it is taken and it contains mixture of different microorganisms, including normal flora and potential pathogens. So isolating the fact that the microorganism causing the infection can be studied without the interference from other microbes. So for the process, it should be inoculation, and then we need to grow it in a pure culture. Number two, the goal is to get any pathogens that are present in the specimen growing in pure culture by themselves and a larger number. So once the pathogen is successfully isolated and grown in large number, it in pure culture, the next step is to identify. So microbiologists perform various tests and techniques to determine the exact species from that microorganism, and the identification process begin, and it involves the microscopic examination, the gram staining to determine if it is gram positive or gram negative, biochemical tests, and molecular techniques. So note to isolate bacteria and fungi from clinical specimens are inoculated into liquid culture media or onto culture media. So in summary, the isolation and identification are fundamental steps in microbiology to diagnose infection by isolating the pathogen and growing it in a pure culture media so that a microbiologist can identify the specific organism responsible for the disease and what to is the proper treatment or and management for that. Next, please.
For the bacteriology section, diagnosing bacterial infection by isolating and identifying bacterial pathogens and conducting antimicrobial susceptibility testing. So, yung first step nito is to isolate bacteria sa clinical specimen such as blood, urine, or tissue samples. And then by culturing these specimens, lab personnel can separate the bacteria from other substances, allowing them to grow in a controlled environment. And once na-isolate na yung bacteria, iba-ibang methods or various methods na yung pwedeng ma-identify sa specific pathogens responsible for the infection. Next is identification, gram reaction, cell shape, motility, and biochemical test result. For conducting antimicrobial susceptibility testing naman, after ma-identify yung bacteria, yung lab test, which is yung antibiotics are effective sa kanila, sa bacteria. So, this concludes na yung information is crucial para sa healthcare providers as it helps them select the right treatment for the patient. Yung in terms of identification techniques, the gram reaction, yung test na to nadi-distinguish yung bacteria based on their cell wall structure, classifying them as gram positive, which is nag-stain ng purple, or gram negative na nag-stain ng pink. For the cell shape, bacteria are categorized by shapes such as cocci, which is spherical, bacilli, rod shape, or spiral. For the motility, this tests whether bacteria can move on their own, which is another factor in identification. And for the biochemical test naman, ina-assess niya yung metabolic activities ng bacteria, which providing additional information that helps in pinpointing their identity. Next slide.
So the individual sections and their function, so the various phenotypic characteristic or the clues is useful in identifying bacteria because it includes the following: the gram reaction to determine if it is a gram positive or gram negative microorganism, the cell shape or the cell morphology, and then the growth or no growth on various types of plated media. Next. So for the mycology section, it handles the fungal infection. This section specializes in the identification of fungal infections. So yeasts are identified biochemically, which and also molds are identified using growth characteristic and macroscopic and microscopic observation. So the technique for this section is that the fungi are cultured and identified using a microscopic examination and a biochemical test. Yeast, like Candida species, are identified through biochemical assays, with, while molds are identified by their growth characteristic and microscopic appearance. So hair, nail clippings, and skin scrapings are processed using techniques such as the potassium hydroxide preparation. For the parasitology section, it identifies diseases by examining various life cycle stages such as trophozoites, cysts, eggs, and larvae. So this section naman is dedicated to diagnosing parasite infections. So the technique used in this section is the parasitologists examine samples that are present in the parasite at various life stages such as their eggs, yung larvae, the cyst, and the adult forms. So these techniques like direct microscopy and stool examination are commonly used. Next.
So for the virology section, diagnosis viral infection using cells culture, molecular amplification, for example, is PCR, and immunodiagnostic procedure, and cell culture remains essential for specific viral characterizations in public health setting. So yung virology section of a microbiology laboratory is responsible for diagnosing viral infection using various techniques, which is yung cell culture na nag-involve ng growing viruses in living cell, yung molecular amplification, ito yung techniques like polymerase chain reaction or yung PCR na used to detect and amplify viral genetic material, and yung immunodiagnostic procedure, ito yung test used for antibodies to detect viral proteins or yung antigens in a sample. Next is microbacteriology section, diagnosing tuberculosis and other mycobacterial infections. The acid fast stain, Mycobacterium tuberculosis, is identified using growth characteristics and biochemical tests. Yung mycobacteriology section nagpo-focus sa diagnosing infections caused by mycobacteria with an emphasis on tuberculosis. Yung acid fast staining, ito yung staining technique na ginagamit para ma-identify ang mycobacteria which have unique cell wall properties that make them resistant to standard staining method. In terms of identifying Mycobacterium tuberculosis naman, nai-involve ang tuberculosis involves observing its growth characteristic in culture and conducting biochemical tests para ma-confirm yung presence ng tuberculosis. So next is molecular diagnostic section, focusing on identifying pathogens using nucleic acid amplification techniques like yung PCR and squeezing. Ang nucleic acid amplification technique, ito yung methods na PCR and DNA na nag-squeeze as an are employed to amplify and analyze the genetic material of pathogen. So yung in short, yung technique na to nag-allow for precise identification and can detect pathogens that may be difficult to isolate using traditional methods. Next.
So here is full identification of mycobacteria is accomplished by molecular probe techniques or by nucleic acid sequencing. So the mycobacterium, the primary cause of the human tuberculosis, is a very slow growing organism. Fortunately, the acid fast stains enable rapid presumptive diagnosis of tuberculosis and molecular assays confirm the diagnosis within a couple of hours. So next slide. So this is the process of mycobacteria like Mycobacterium tuberculosis, which causes tuberculosis testing. So the first thing is to collect a sputum sample from the patient. And then after that, we need to lyse the bacteria over here by adding specific chemicals like the DMS, which releases the bacterial DNA. And after that is we need to filter the mixture to capture the DNA attached to the DAPDMS. And then fourth is to release the DNA by adding the high pH solution, which separates it from the DAPMDMS. And then we need to analyze the extracted DNA using a quantitative PCR to detect the presence of bacterial DNA. So that is the process on how to determining the if there is a Microbacterium tuberculosis on a patient. So next, please.
For the diagnostic techniques, isolation and identification, pathogens are isolated in pure cultures for accurate identification and antimicrobial testing. Molecular techniques, techniques such as matrix-assisted laser desorption ionization time of flight of MALDI-TOF, and 16S ribosomal RNA sequencing are used to identify difficult organism. MALDI-TOF, this is a fast method that uses a laser to analyze the proteins sa bacteria. It also helps quickly identify the type of bacteria or fungus present in a sample. The 16S RNA sequencing, this technique looks at a specific part sa bacteria DNA, allowing for precise identification ng bacteria, even those that are difficult to grow in the lab. And third is antimicrobial susceptibilities testing. The three main methods are employed: this diffusion, broth microdilution, and gradient diffusion. These tests determine the minimal inhibitory concentration or MIC of antibiotics against the pathogen. So, ang this diffusion, ito yung method na yung paper nagdi-soak in antibiotics are placed sa agar plate where the bacteria are grown. Ang broth microdilution, this involves mixing different concentration of antibiotics in a liquid medium to see what concentration the bacteria had stopped growing. Na-determine din ito yung lowest effective dose or yung MIC for treatment, and yung gradient diffusion, similar siya sa this diffusion, but it uses strips na nag-create ng gradients of antibiotic concentration.
So just a relation from our previous experiment, which is experiment 8, the antimicrobial susceptibility test. Yung ginawa natin is yung disc diffusion, which is yung mga maliliit na discs ng antibiotics nilagay sa petri dish with FHA and specific microorganisms. So that's all for group 3, the chapter 12 and chapter 13. We hope you have gathered or garnered essential, significant knowledge regarding this topic that will be helpful for your midterm examination. That's all. Thank you. Thank you, sir.
Bye!